Guest number two is a retired physician. He is also founder of a national organization called Health Watch USA. His editorial comments are published in papers and articles all over the country and the world, for that matter. Dr. Kevin Kavanagh. Dr. K, good morning.
Good morning, sir.
Glad to have you here this morning, as always.
Well, thank you.
I was with a guy the other night. I won't mention his name, but I wish I had had you with me because you could answer or comment on his comments much better than I. But he said, I'm not going to get that vaccine. I said, why not? Well, first of all, there's a lot of people that I do business with in the medical community, like pharmacists and nurses, and they say they're not going to get it. And I said, well, why are they saying they're not going to get it? Well, 3 months is way too short of a time to have any idea what they're doing in terms of a vaccine. They push that thing out way too fast. And I mean, it was like, I'll think of it here in a minute, but there were like 2 or 3 more things that he said were reasons he wasn't going to get the vaccine. What do you say to people like that? Or do you just throw up your hands and go, well, we've lost that one?
It's very difficult, and it has to do with people not being able to judge risks. And this is very frustrating. And Jack, I would have corrected him that almost all of vaccine complications occur within the first 2 months. And so if you have 3 months of data, you really do encompass most of the complications. But right now, we actually have 6 months or more of data. They continue to follow these people. So your concerns that you had back in November, when the vaccines came out and were authorized with 2 months of safety data, right now don't really exist because we now have over 6 months of data. Over 100 million doses have been administered without any attributable deaths in the United States. That is just a phenomenal record. 4 million people are getting this vaccine every day, and yet people will center on 1 or 2 people out of all of those that have had a bad reaction, which was able to have been treated. And another example of that is what's happened in Europe. Now, they are dealing with a different vaccine, this Oxford AstraZeneca vaccine, and it has now been linked with blood clots. There have been a number of official reports coming out, and there were, about 30 people out of 22 million doses that developed blood clots. So that's about 1 chance in 750,000. Very small. Now, granted, these people that developed blood clots were very serious. There were 22 reports of cerebral venous thrombosis, etc., but very few people. So Europe fell way behind with vaccinations. And they are right now in a horrible surge, losing 4,000 people a day, let alone all of the disability which is occurring with long COVID. Compare that to England, that has vaccinated almost half of their people. Their rates are falling, and they're starting to open up their economy.
Are they using the AstraZeneca product at all in England?
Well, they have restricted it now, especially, or at least they're talking about restricting it in the younger individuals. But yes, they have used that product, and they've also used other products. So the vaccinations we need to do, and we really do need to keep our eye on what risks are, and don't get afraid because you hear a few stories of a few people compared to millions, hundreds of millions of people that have had the vaccine and thousands of people which are dying every day of COVID. So risk judgment is hard. We need to get the vaccine, and the vaccines we're using in the United States have a better safety profile, at least in my opinion, than the Oxford AstraZeneca vaccine.
Okay, one more thing, and then we're going to take calls, and we've got texts as well. But we had someone that texted the other day, and he made the comment, my wife and I are fully vaccinated, and so we're not wearing masks anymore. And I said, I think that's not exactly what the government would have you do. And then I got several texts or emails from people saying, why do we wear the mask if we're fully vaccinated? Well, my answer to that was, A, the vaccination's not 100%, and B, there's a huge percentage of people out there, who haven't gotten vaccinated yet. But how would you answer those critics?
Well, I actually wrote an article on that in Infection Control Today, which was published yesterday. And this gets into the other problem with vaccination, and that's all or none thinking. That if I'm vaccinated, I don't need to wear a mask. If I have to wear a mask, then the vaccine's not any good. What you need to remember is no vaccine is 100% effective. And with these variants that are on the horizon, and believe me, if you look at Michigan, their case rate is out the roof. It's greater than over the holidays right now. So no vaccine's 100% effective, but it can blunt the disease with these variants. And that's why you need to get vaccinated. And it will also help to prevent the spread of virus. In other words, it'll cut down on the spread, which is just crucial to cut down on the mutations. Now, I should also note that if you look at these skyrocketing cases in Michigan, you don't see the same skyrocketing of deaths. So the deaths may be delayed, or the vaccine may work fairly well in older people in warding off death in the most severe sequela. But unfortunately, Jack, with this virus, even if you have mild disease, you can have long hauler syndrome. I mean, some of your guests on Wednesday even scared me when they started talking about the neurological problems, etc. So you do need to wear a mask, both to keep yourself from getting infected or to help keep yourself from getting infected. It's nowhere near 100%. It helps you from spreading the virus. And if you don't spread the virus, it will keep down the viral mutations. And that's the problem we're having now. This virus is tending to mutate faster than they can get out boosters for that vaccine. In other words, the E484K variant, which is found in South Africa, Brazil, and New York viruses, that variant needs to have a booster. It's already spreading in the United States. The booster's being tested, but not available. That's different than the flu vaccine, where you're getting the vaccine ahead of the variants which they think are going to come into the country. So we're falling behind. We need to cut down on viral spread. That is key. It is all within our hands. There is no question we can win this battle. We're in the last inning. It is very, very easy for us to do this with vaccinations and public health strategies and following them. Unfortunately, at this point, too many people are vaccine hesitant. Too many people don't want to wear masks. We have too many businesses that haven't upgraded their ventilation, and that includes schools. All of this needs to get done. Once it is done, we can get a handle on this pandemic.
To the calls we go. Laura, thanks for holding.
Good morning, Jack.
Morning.
Good morning, Doctor. This problem with people not wanting to get the vaccine for the sake of other people, and they think they're going to do just fine. They don't care. How about making it worth their while and getting some people to submit actual hospital bills that you can talk about? Now, I understand the vaccine probably will keep you out of the hospital. What does it cost to be in the hospital for 2 or 3 weeks anymore? Best case scenario, that's without ICU. Just an idea. Maybe it would be worth it to them to get the vaccine to protect their own pocketbook.
Yeah, that's correct. I mean, it's extremely expensive to be in the hospital, but also just because you leave the hospital and you have what they'll say is, and I put in quotation marks, recovered, you've actually just survived. And that's a pretty low bar, because then a vast majority of patients that are severely sick, for example, in the ICU, are going to be suffering with chronic symptoms, and probably 60 to 80% of those people in the hospital will have some symptoms that are long-term, up to 9 months or more. So we really do need to get people following public health advice, wearing masks, and getting the vaccine.
Kevin Kavanagh, 253-5959. Or, that's our phone line if you want to talk to him, or you can send us a text, which a bunch of people have, Kevin. Let's see if we can get to a bunch of them here. Good morning, okay. Jack. In your discussion about COVID, could you ask about the proper protocol for masks for those of us who have been vaccinated? What is the purpose of masks? I am protected by the vaccine and cannot pass the virus to others. That's a question, and the reason I read that, even though you just addressed it, is we got about 6 of those that's the basic question. And so again, just to recap, it's because of
the variants. That is the main reason. You are going to have a high incidence of spreading that variant, because if you say the virus isn't going to kill you or make you go into the hospital if you get the vaccine, that pretty much assumes you can get infected and a little bit sick and spread the virus to others. And spreading the virus to others, if they're not vaccinated, is of course a risk to those individuals, but it's also the underlying mechanism which causes that virus to mutate. The more you spread it, the more chances there are that it will mutate, and it could then totally evade the vaccine. So it is very important that we continue to follow public health advice until we get a handle on these variants and we get the viral caseload down. That is absolutely critical. A lot of the messaging and misinformation is done because it's applying logic to the wild type of virus with the type of viruses we're seeing today. And that just doesn't work. So please get vaccinated, but view that as a layer of armor. Still, you need to wear a mask and follow public health advice.
All right, we got a call. This is Ed. Hey, Ed, you're on with Dr. Kavanagh. Good morning.
Good morning, gentlemen. Good morning, doctor. I need some convincing. The mask situation. If I walk past somebody who's smoking, I can actually see that smoke. When I walk through that smoke cloud, I can smell that smoke. So how is a mask that I supposed to filter out a pathogen, a virus, that I can't see, when this same mask can't filter out smoke that I can see?
All right, now what type of masks are you talking about? Cloth masks, N95s?
I've used both, and the result is still the same.
All right, well, first of all, it depends on particle size. A lot of the things that you smell in that smoke are extremely small molecules like ammonia, much smaller than a virus. When you look at the viral size of COVID-19, the type that aerosolizes, and that's what you're concerned with, is aerosolization, has a size of between about 10 to 100 microns, which is bigger than the 5 microns that the N95 mask is designed to filter out. And that size of a virus can be produced by loud talking and loud singing. And that is one of the reasons why a cloth mask has some efficacy, or it tends to reduce your viral load. And as we've stated in other shows, this is really a chance game. You're looking at reducing viral load and viral exposure. The chances of you getting COVID from just one virus coming through that mask is extremely small. So it is a numbers game. The better mask you have, the further you're away from that person, the less likely you're going to be exposed to a critical number of viruses to cause you to get an infection. There's also fairly good research and, I would say, science behind the idea that viral load is also related to symptoms that you develop. In other words, if you're hit with a lot of viruses, a lot of soldiers on that beachhead, you may well develop a more severe case of COVID. So wear a mask, but it has to be well fitted, no holes on the sides, multiple layers, and if you can, get a KN95 or an N95 mask.
Appreciate your call. Here's one I was trying to find from our Auto Tech Service text line. Should I be concerned about the adverse reactions from the Johnson & Johnson COVID-19 vaccine that shut down 2 locations recently in the United States? I'm scheduled to get the J&J vaccine next week.
I would say no. They are really looking at the type of adverse reactions that people are having, and they're keeping good quality control on those vaccines. I have not heard of any adverse reactions that are related to a vaccine which is in a lot number which has been cleared and manufactured well. I do know that Johnson & Johnson had a manufacturing problem. None of the vaccines were distributed. They did shut down some plants, but that's because of good quality control. That should actually make people feel safer. Mistakes are going to happen. We're set up to catch them. They have protocols for that. That happened. The plant was closed, and I think that some vaccine distribution was discontinued. But that's not a problem with a vaccine itself that's gone through the proper manufacturing and clearance processes.
Here's another that says, I'm 36. I'm not taking the vaccine. I'm not going to be the lab rat. And 10 years down the road, calling an 800 number for if you or a loved one have taken the corona vaccine, you may be entitled to significant compensation. No thanks.
Well, I hate to tell you this, but you're all kind of in an experiment. Anyways, you've just elected to be in the control group. And right now, what I'm seeing from people who aren't getting the vaccine, the control group is not doing very well. So yeah, you may well be in an experiment or a report 12 years down the line, but you'll be in the group of individuals that didn't get the vaccine. And right now, it's not looking very good for them with long haulers and long COVID type of syndromes.
Another negative here. We're getting mostly negative. 99% who get the COVID survive. I will keep my immune system supported rather than take experimental drug, especially when the drug company has no liability. Spread now is minimal. Stop the fear mongering. The doctor should be ashamed. Masks do not work. No medical evidence for it.
All right, tons of medical evidence that masks work, even cotton masks. They think actually the cotton itself may increase humidity, which kills the virus in a separate way of filtration. Believe me, spread is still far too high. Just go on John Hopkins' site or Worldometer and look at what's going on in Michigan. More cases now than over the Christmas holidays. Same is starting to happen in New England. So that's not the case. And believe me, if your measure of living is just surviving, that's a pretty low bar. Come on, you've got people with chronic heart disease, CNS problems, breathing problems, and this, well, it's not just a rare occurrence, unfortunately. This is occurring frequently in people that even have mild cases. So you are taking a risk of chronic disability. Do not go that route.
Okay, this says Mike. Mike says, when will we know that we've reached herd immunity, or will we ever get there with all these variants around?
Never, because of all the variants. The virus is also endemic in animals. As we said multiple times last year, herd immunity makes no sense. It won't be achievable if you keep spreading the virus. And they did. It's become endemic, and I think we're going to need to learn to live with this. Part of that is getting the mutation rate of the virus slowed down so our pharmaceutical manufacturing can keep up with vaccine production. And I should add, with these variants, they cause reinfection. This is the South African variant, the Brazilian variant, the New York variant. Reinfections do occur. So just because you had it one time and think, oh, I'm done with this, that's not the case.
Thank you, Dr. K. We will talk to you next week.